Are you experiencing unexplained knee pain? In this video, we'll explore 5 key reasons of knee pain leukemia. So let's delve into this. Wait, before starting the video, we introduce you with Joint Restore Gummies, which will help you to relieve knee pain naturally. For more details, click the link in the video description below. Reason 1. Bone and joint involvement. One of the reasons knee pain might be connected to leukemia is the potential involvement of bones and joints in the progression of this blood cancer. Leukemia can affect bone marrow function, leading to changes in the structure and composition of bones and joints, which may result in localized pain and discomfort, particularly in areas such as the knees. Understanding the potential impact of leukemia on bone health can help facilitate timely intervention and appropriate management strategies to address both the underlying condition and associated knee pain. Reason 2. Joint inflammation. Leukemia can sometimes lead to joint inflammation, which may manifest as knee pain among other symptoms. Inflammatory responses triggered by leukemia can affect the synovial lining of the joints, causing swelling, stiffness, and pain that can be localized in the knees. Prioritizing regular medical assessments, including joint evaluations, can help identify and address potential signs of joint inflammation associated with leukemia, promoting timely and effective treatment interventions. Reason 3. Side effects of treatment. Certain treatments and therapies for leukemia can lead to side effects that include musculoskeletal issues such as knee pain. Chemotherapy, radiation therapy, and certain medications used in leukemia treatment may affect bone density, muscle strength, and joint health, contributing to knee pain and discomfort as a secondary effect. Open communication with healthcare providers and comprehensive management of treatment-related side effects can help minimize the impact on knee health and improve overall comfort during the healing process. Reason 4. Muscle weakness. Muscle weakness resulting from leukemia-related fatigue and reduced physical activity can indirectly lead to knee pain and discomfort. Leukemia can cause extreme fatigue and weakness, limiting physical mobility and leading to muscle atrophy, which can affect the stability and function of the knee joint, resulting in pain and reduced range of motion. Implementing tailored exercise programs and rehabilitation strategies, as guided by healthcare professionals, can help improve muscle strength and support better knee joint function, enhancing overall well-being and comfort. Reason 5. Systemic effects on pain perception. The systemic effects of leukemia on pain perception and sensory processing can contribute to the experience of knee pain. Leukemia can influence the body's pain signaling pathways, leading to heightened pain sensitivity and altered pain perception that may manifest as knee discomfort, even in the absence of direct joint involvement. Engaging in regular pain assessments, exploring pain management techniques, and maintaining open communication with healthcare providers can help address the complex interplay between leukemia and pain perception, ensuring comprehensive support for individuals experiencing knee pain. Where to get the Joint Restore Gummies? Get Joint Restore Gummies from official website. Click the link in the description below. Thanks for watching. Don't forget to subscribe, like, comment, and share. Until next time, stay tuned.